Across the nation, jails serve an estimated 2 million people with severe mental illness each year. And those with mental illnesses tend to stay in jail longer and often return to jail. But in an effort to help people who suffer from mental illness, the Stepping Up program was created. To tell us all about this program and how it creates an intersection between the legal system and mental health is retired Ohio Supreme Court Justice Evelyn Lundberg Stratton. Evelyn, thank you for taking the time.
Well, thank you for having me, and we're really excited to come and visit Mahoning again, even though it's going to be by virtual. Mahoning signed up in 2016, so we had an in-person visit, and then they signed, we had a second visit in 2021, and now we're on our third visit. But Stepping Up was designed by the National Sheriff's Association, going to the National County Commissioners Association and saying, we're the de facto hospital, and we don't have the tools or resources to take care of these people. They closed all the hospitals and put them on the streets and didn't take care of them, didn't put the resources in, and now they're in jails and we need help. And so that started Stepping Up 10 years ago. I left the Supreme Court 12 years early because I really wanted to devote more of my time to these causes. I had been on the bench 16 years already. So I joined Stepping Up and became its project director and started doing these county visits, which are so important because we bring state resources, but we also get the county to connect within themselves and find things they didn't even know they had.
And what are some of the most common offenses that put people in jail rather than, them going and getting the help they need? Why did they end up in the jail?
Well, they're often homeless. They need food. They commit crimes of not convenience, but opportunity to get some food or get shelter or whatever. A lot of times their mental illness makes them behave in ways that are very strange, and so people call the police on them because they don't know what their erratic behavior is, or families sometimes have a loved one that they call the police on because they can't do anything more with the family member. So they come from different sources, but they're mostly lower level crimes that just cycle in and out, in and out. And our goal is to break that cycle and get them into treatment.
And that initiative provides a roadmap to get them the care they need. Can you give us an example of what that roadmap might look like for someone?
Well, for example, if you're arrested, they now, because of Stepping Up, almost every jail does a screen, a mental health screen or a veteran screen to see if you're a veteran, a drug screen, and they're basic, simple questions. But if you answer yes to any of them, then they kick you to the next level of interviewing and screening, where they try to get you then some resources while you're in jail. But more importantly, if they're often there are short-term stays and they need to connect them with resources when they get out. Housing is absolutely the most crucial one you have. If you get somebody stable in housing, you will save thousands of dollars in every other system that you don't always add up. And it's the cheapest way really to take care of it, the most humane way. And that breaks the cycle. So our goal is to try to get them out of the jail, into treatment, into homes, and break that cycle.
Yeah, and you work with the local officials, like you mentioned. Organizations are working to address this challenge. 66 of Ohio's 88 counties participate in this. How does Stepping Up Ohio team know which challenges each county needs to address? Are there certain ones depending on where you're at?
It's all very local. So when we do these meetings, as we do them now, I have 10 team members that present, someone on housing, someone on police. NAMI presents, behavioral health talks about those resources. So we have a lot of presentations, but we encourage a lot of local presentations because a lot of times the left hand doesn't know what the right hand has, or they don't know what they need, and they often find out more about each other because this is a room where everybody comes together. It does usually have different groups meeting here and meeting there. These people all come together in these meetings and gives them a chance to make connections and then tap into some state and federal resources they may not know they were eligible for.
Oh, wow. Yeah, definitely a team effort like you described there. Evelyn, thank you so much for joining us here on 21 News at 5 as we try to spread the word about this program.
And thank you for helping to spread it because it's important that everybody know about it and participate.
Absolutely. Thank you.